Okay, seems like we can get started. So, welcome to my presentation on nursing shortage in hospitals. I chose this topic because I'm going to major in nursing, and this is the problem that nurses face. So, overview. So, during this presentation, I will be going over an introduction, thesis, is it really a problem, understanding the problem, how it's affecting everyone, how it can change, and a conclusion. So my thesis is, how neglectful is it for hospitals to have short staffing? So is it really an issue? Some would argue that nurses are glorified. Nurses are put above the majority of hospital staff and are respected without question. Every type of person in the hospital needs to have respect, but sometimes depending on the setting of where people work at, nurses can sometimes get away with things. For example, when working in an assisted living home, both CNAs and nurses have responsibilities that they need to complete each day. But because the nurses went to school longer than CNAs, nurses tend to pass over all of their own work onto the CNAs, and that causes CNAs to get worked harder than they need to. Hillary Thomas wrote, "In the end, the CNAs do the dirty work and the doctors do the hard work." Thomas wrote an article that people need to stop with glorifying nurses. It is always a common thing to hear that nurses are always complaining about their job, that they have to come in during holidays and important events. But they overlook the fact that many staff in the hospital also have to sacrifice time to be in hospitals. But why aren't nurses reprimanded for complaining, but others are if they do? Adding to that, nursing students are a big part of that too. Thomas says, "Students in nursing school complain about being stressed out more than I have ever seen any student complain. But I am 100% sure that chemical engineers and physics is harder than nursing, and you don't see them complaining half as much as nurses do. Because for some reason, complaining about how hard our job, school, life is seems to be acceptable among nurses. In the end, nurses know that they were going into when they decided to be nurses." So, hospital budgets. According to AP News, hospitals were conservatively add between $676 million and $949 million in annual healthcare costs. What that means is that there would be a 4 to 6% increase for every nurse. When doing the math, hospitals around the world would have to hire an additional 301,000 nurses. As great as it would be to have a 1-to-1 nurse to patient ratio, what people need to think about is that sometimes it just can't happen. If hospitals were to hire more nurses, hospitals would somehow have to cut back on other things to keep the budget in place. And for the majority of the time, a lot of those statistics are for big hospitals in large cities. No one really thinks about the small hospitals in small towns. The small hospitals can only hire so many doctors, nurses, anesthesiologists, janitors, etc. And hiring more nurses could cause smaller hospitals to get into trouble and possibly even close. But now we're going to understand the problem of short staffing. So, giving a bit of background, on average, the number of patients to nurses can be 1 to 5 or 1 to 8, depending on the unit and needs of the patient. And without really knowing the insides of being a nurse and working in a hospital, 1 to 8 might not seem like a lot. But the thing is that some patients require frequent checkups and physical work, especially when you're in an assisted living situation. There are residents who are required to be checked up every 2 hours and then adjusted to different positions to avoid bed sores. And in that workplace setting, a lot of the times it's two nurses for an entire hallway, which, depending on how big a building is, can range from 15 to 25 residents. When a nurse has many patients, it gets exhausting. Patients always require something, and some workdays can be worse than others. Nursing shifts average 12 or more hours, and when you're a nurse, your workdays aren't calm. Very rarely do you get bathroom breaks, lunches, or just a bit of rest between working. Some nurses, though, win the lottery and only work 3 times a week, but there are those who just need the work and end up working 2 weeks straight or more, and each shift is 12 hours long. So, how it affects everyone. When hospitals have a very short staff, it can lead to medical mistakes. They can have devastating outcomes. Mead, a nurse herself, quotes, "I am incredibly exhausted after every shift that I work. so mentally and physically exhausted. I feel like some days I think of everything I did that day and think, I could have done this for this person if I had just had the time to get to it. This means that nurses are so exhausted that medical errors can occur, and sometimes that means too much or too little of a certain medicine can raise a percentage of a patient possibly passing away. It's not just nurses that get affected by short staffing. Cross and quotes. Inadequate nurse staffing levels by experienced RNs are linked to higher rates of patient falls and infections, medical errors, and even death. This means that nurses are so exhausted that medical errors can occur, and sometimes that means either too much or too little of a certain medicine can raise a percentage of a patient possibly passing away. It's not just nurses that get affected by short staffing, patients are in danger too. Carlson quotes, inadequate nurse staffing levels by experienced RNs are linked to higher rates of patient falls, infections, medication errors, and even death. How it's affecting now. It's clear that nurses and hospitals are clearly understaffed. There are some hospitals that have changed according to state laws that they have to abide by. But if you look at the bigger picture of how it truly does affect patients and people worldwide, we come to this. As of right now, the entire world has a large pandemic, COVID-19. COVID-19 is a new strain of coronavirus that has not been previously identified in humans. COVID-19 is the cause of an outbreak of a respiratory illness first detected in China. No one expected this pandemic to grow as fast as it did. The nursing shortage in hospitals is taking its toll right now more than ever. Since COVID-19 is easily spread through sneezing, coughing, and/or touching, that means that there are many more patients in hospitals now than there has ever been in the last few years. Hospital equipment is running out everywhere, and nurses and doctors alike are in danger every day. When hospitals run out of equipment, that means that nurses are at a higher risk of exposure to COVID-19 since they are the closest to patients all around the clock. And when that happens, they will get sick and they won't be able to go into work, limiting even more the amount of nurses in hospitals. In the eastern western cities, where COVID-19 is hitting the hardest, nurses each day are testing positive for COVID-19. It is estimated that there are 200,000 nurses in the country right now. What will happen when it is too unsafe for nurses to go to work because they are too sick? In Italy, there was a plan to try and recall retired nurses and doctors back into the field, and that may be the only way to increase staffing numbers. Short staffing is happening all the time, but the very core of a mass pandemic changes. The change that I propose that could happen have to happen over a long period of time. It can't possibly happen overnight. I suggest the hospitals simply start hiring more nurses slowly. There's no need to hire thousands of nurses at once, maybe a couple hundred for the big hospitals and around 40 to 60 for smaller hospitals. That way medical bills won't be raised so high and the small hospitals and towns won't feel the financial blow so hard. At Pikeville Medical Center in eastern Kentucky, saw its need for nurses boom. It was already hard to hire nurses, so they had to get creative. So administrators offered a $25,000 signing bonus as compared to the bonuses of $5,000 to $10,000 many hospitals offer these days. Although there was a catch, nurses had to sign a 5-year contract. So in conclusion, it is clear that dangerous errors happen when there is a short staff. And at a time of great need, having a number of nurses is not ideal. Nurses are often overweight, have higher levels of stress, and get less sleep than the average person due to the fact that healthcare requires around-the-clock support. It is obvious that things will not change overnight. We can only hope that the things will start to change because in the end, healthcare workers are here for the good and well-being of their patients. Like it was once said, if it were easy, everyone would work in medicine because it's the best job in the world, despite of everything. Thank you.